When you go home from surgery or an inpatient hospital stay, it can be isolating. You don't have access to someone to ask all your questions to.
Our hospital, much like many other hospitals, we're having a lot of issues with bed crisis, a lot of return visits to the emergency. So we saw an opportunity to assist these patients decrease unnecessary emergency department visits, reducing readmissions, and of course, the length of stay, just to help with that bed crisis.
Patients are nervous, anxiety-ridden about their surgery before and after. I think of Seamless, and I would explain it to them as a bit of a lifeline when you're feeling alone and have any questions. Is somebody to ask besides your physician or a friend if you're alone at home.
I would explain it to a patient as your digital friend. It's a companion that helps you as you are preparing perhaps or waiting for your surgical intervention or your visit at the hospital for whatever that might be.
They can download the app on phone, tablet, so if they lose the piece of paper or they're not listening, they can always fall back on the app.
SeamlessMD is used at both ends of the spectrum for us when it comes to surgery. So before the surgery, it is used for education for the patients. They have access to the library. They can familiarize themselves with the content. There's also reminders, their surgery date, use the chlorhexidine wash, whatever it may be. And then after the surgery, it's used more for remote patient monitoring.
It's something that gives them that little bit of extra comfort in knowing that somebody's keeping an eye on them after surgery.
A few things we wanted to achieve with it were decreasing our length of stay, increasing our same-day surgical volumes, and then, of course, decreasing our emergency visits or post-surgical readmissions, all of which have drastically improved, like considerable amounts. The orthopedic surgery team loves it. They can't speak enough about it.
For my area, we have about 1,600 hip and knee replacements a year, and I'm the only nurse navigator. So all the calls, all the emails were coming to me. And what Seamless was very helpful in doing is just to kind of answer some of those more basic questions that we can predict. It reduced number of phone calls to me and allowed me to focus on the more urgent issues.
Our ED return dropped significantly, I think. It was about 54% in the first year for our hip and knee pathways, so that was really significant.
We're now deployed with multiple other program areas. We're doing arthroplasty for hips and knees. We're doing chronic heart failure, which is fantastic. We're doing liver, and we're just getting ready to launch our moms and babies program.
Patients and family members are looking for technology in their hands. They're looking for information that can be available very readily. SeamlessMD absolutely ticks every one of those boxes with very, very high satisfaction.
One of the differentiators, and I've said this many times, of working with a partner like SeamlessMD, your team makes it very easy. The data demonstrates that this is a fantastic investment. The data demonstrates it's a fantastic experience for our patients, for their families, and it's been a great experience for our care teams. They are now able to be more proactive and not reactive, taking the calls or trying to coordinate follow-ups with patients.
We find that this has been very, very beneficial to our patients and families, bringing our organization forward as a technology-based organization, and we look forward to the future and our future work together.